Hello. Uh, I'm doing these videos, so hopefully we won't get too far behind. All right. Hopefully, we could be in the classroom soon. So, this is chapter 20, allergic reaction. All right. So, allergic reaction. Your immune system naturally responds to foreign substances in the body. All right. Whether it's allergic reaction, it's aggravated response to a foreign substance. All right. It's a foreign substance in your body. Your body reacts to it. All right. So and then there's an allergen. It's whatever that substance is that's aggravating, um, exaggerated into the body. All right. So now inside your body, your first exposure, when you get exposed to whatever foreign body it is, your body forms antibodies. All right. Antibodies identify and attempt to attack the particular foreign substance. And antibodies combine with the allergen and where they were formed in response to them entering your body. All right. The second time you come in contact with whatever the substance is, the antibodies already exist in there. So the antibody combines with an allergen, leading to release of histamines and other chemicals into the body. And chemicals cause harmful effects. And what are these harmful effects? Could start swelling, right? Which is called inflammation. Bronchial constriction, it's going to make it harder to breathe, and also vasodilation. All right, so if you go into anaphylaxis, it's severe life-threatening allergic reaction. It could come on rapidly. Rapid dilation of the blood vessels, and it causes hypertension. Right, airway swelling, it causes like an airway obstruction. It causes that airway obstruction, so it's going to be harder to breathe. We always say, no airway, no patient. So that's a very serious threat. So we have to take care of that right away. And then bronchial constriction, it's going to cause respiratory failure. All right, remember, no airway, no patient. All right, you have respiratory failure, and then you're going to go into, and then your patient will go into cardiac arrest. There are different allergens that people come in contact with. Some could be insects, whether they're working outside, get stung by bees. It could be food, right? They could be allergic to eggs. They could be allergic to shellfish or fish itself. Plants. Some people, they can come in contact with poison ivy. Nothing happens to them. They don't get any of that itching and whatnot, but other people that happen to be allergic to whatever type of plant, poison ivy, poison oak, right? And they could also have an allergic reaction, which is the blotchy skin, very itchy. People could be allergic to medications, right? That's why it's also good to get a good history from your patients. Did they start on any new medications? Because whatever could be happening to them could have been caused from that new medication that they happen to be started. Excuse me. Others is dust, makeup, soap, etc. You can have somebody goes, oh, I'm very itchy, and for the last few days and whatnot. And if you can ask them, hey, laundry detergent, did you change your laundry detergent lately? That could be something that could be bothering them and causing a rash or whatnot. All right, and here's some of those common allergens, the bee stings, shellfish, peanuts. You'll see a lot of places now, especially in schools, it could be a peanut-friendly school, like peanut-free school, sorry. All right, it could be a peanut-free school. A couple of classes ago, EMT classes ago, we had a patient, severe allergic reactions to peanuts. So we it made it a peanut-free classroom. Other reactions, latex allergy, common concern in EMS. Years ago, a lot of stuff we used in EMS was latex-based. All right. Over the years, they phased latex out. People, EMS workers, hospital workers, they started to develop a latex allergy from using it so much. So almost everything in this, anything in the back of a rescue now or ambulance is latex free. There's no way to predict exact course of an allergic reaction. All right. Severe reaction often takes place immediately. All right. But it could be delayed. All right. It could take up to 30 minutes or more. All right. Mild allergic reaction can rapidly progress into anaphylaxis. All right. So that's why we want to closely monitor these patients when they're in our care, because they can go downhill really quick. And what are some of the signs and symptoms? Their skin could be itchy, develop hives, flushing, which is a red skin, turning reddish in color, swelling of the face, warm, tingling feeling in the face, mouth, chest, feet, and hands. Right, just shows this person's skin turning red. He's starting to swell up. You can see his right eye starting to swell up there. And here's some blotchy hives on somebody's leg. Maybe they came in contact with something and it started to swell up and be itchy. All right. What are some of the signs and symptoms we're going to be looking for? All right. Respiratory. They could feel a tightness in their throat or chest. They could develop a cough. Their breathing could be rapid, labored, or even noisy. All right. You walk into the room, you can hear them breathing from across the room. Their voice could be hoarse, muffled voice, or even no voice. They could lose it altogether. You could hear when they breathe in and out that stridor or wheezing. All right, so what's going to happen is anaphylaxis is one form of shock. All right, so what happens when somebody goes into shock? Their cardiac output is going to be increased. All right, so very cardiac output is going to be increased. Decreased blood pressure. Blood pressure is going to go down. And signs and symptoms, generalized findings, itchy, watery eyes, headache, runny nose, and that impending sense of doom. All right, they're going to say, oh, I feel like I'm not going to make it. All right, take them very seriously. All right, they know their body better than you know their body. So take your patients very seriously when they say that. All right, they could also have an altered mental status. Might be confused where they are, all right, and who they're with. They're going to have that flush, dry skin or pale, cool or clammy. Could feel like nausea or vomiting. Changes in their vital signs. It could be increased pulse respirations because they're going into shock, and that blood pressure is going to start to decrease. All right, any of previous signs and symptoms can be associated with allergic reactions. Anaphylaxis patient has either respiratory distress or signs and symptoms of shock. All right, your patient assessment of these patients. All right, identify and treat any life threats. All right, what do we always say? We want to make sure we protect that airway, their breathing and circulation. In your secondary assessment, we're going to get a history of allergies. All right, did this ever happen to them before? And if it did, what was the outcome? Right? Did they end up being hospitalized, or was it something that was taken care of at home? All right, but that could be a problem right there because they already had an allergic reaction to it in the past. Could be even worse the second time around. So we've got to watch these patients. All right. What were they exposed to, and what route was it? Was it something that the patient touched? Was it something they ingested? All right. What are their signs and symptoms? Progression and interventions. All right. Progressions. What has happened since they came in contact with whatever the allergen was. All right, so now we want to get those baseline vital signs. Very important to get those baseline vital signs. So now, when we're transporting, we could get a trend. All right, when we take our next set of vitals, all right, did their vitals get better? Did they get worse? All right, that's how we're going to monitor our patients to see how they're doing. All right, now we're going to obtain remainder of the past medical history. All right, so what are we going to do for this patient? First and foremost, their airway. Manage their airway and breathing. High flow O2 via nasal cannula. Mild reaction does not require oxygen. But if they have any trouble breathing, tightness in their throat or whatnot, all right, we can give them O2. If they're not breathing adequately, we can also breathe for them. All right, use our bag valve mask and actually help them with ventilations. All right, so now as an EMT basic, you can assist them with their auto injector of epinephrine. All right, so if that's the case, if they can't give it to themselves, you can actually assist them with that. If the patient is not wheezing or showing signs of respiratory distress or shock, we're just going to continue with their assessment, consult medical direction regarding the use of the auto injector. All right, I had a patient one time. We got called to a school, and when we got there, the school nurse met us at the door, took us to the patient. It was a young girl, and she goes, "Oh, I gave her the Epi Junior pen." I said, "All right, what was her signs and symptoms? What was going on?" "Oh, she might have had some peanuts." I said, "All right, did she have any tightness in her throat? Was she any respiratory problems?" "No, she might have had some peanuts." In that case, we don't want to give anybody any medications if